How effective is oseltamivir compared to a placebo? When it comes to fighting the flu, many people wonder if medications like oseltamivir really make a difference. Oseltamivir, often called Tamiflu, has been studied extensively in clinical trials to see how well it works compared to doing nothing at all. The results show a mixed picture, so let's explore what the evidence tells us. Starting treatment early is key. When oseltamivir is taken within 48 hours of symptoms appearing, it can modestly shorten the duration of illness. For example, in a large study involving over 1,000 participants, those who took oseltamivir saw their symptoms last about 1 day less than those who took a placebo. But this reduction was not always statistically significant, meaning it might not be a huge difference for everyone. If treatment begins after 48 hours, the benefits become even less clear, with little to no difference in how long symptoms last. Oseltamivir also affects viral shedding, which is how much virus is released from an infected person. The medication can reduce the amount of virus in respiratory samples during treatment, which might help lower the chance of spreading the flu to others. However, the clinical importance of this reduction is still debated among experts. One of the more promising uses of oseltamivir is as a preventive tool. When given to people who have been exposed to someone with the flu, it can be highly effective. Studies show that it can prevent about 80% of cases in household contacts, especially against influenza A. It provides complete protection against influenza A in some cases, and around 78% against influenza B. This makes it a useful option for protecting vulnerable individuals or those at high risk of catching the flu. In children with confirmed influenza, oseltamivir has been linked to a 30% reduction in ear infections, a common complication. But when it comes to preventing serious outcomes like hospitalization in outpatient adults or teenagers, the evidence is less convincing. Recent reviews suggest that oseltamivir does not significantly reduce the risk of hospitalization or severe complications in otherwise healthy people. Regarding symptom relief, oseltamivir offers only a tiny benefit, about a third of a day or roughly 8 hours faster recovery compared to standard care. For most people, this small difference may not be noticeable or worth the potential side effects. Speaking of side effects, gastrointestinal upset, especially vomiting, is the most common issue. Studies show that people taking oseltamivir are more likely to experience vomiting than those on placebo. Overall, serious adverse effects are rare, but gastrointestinal discomfort is something to consider. Timing remains a critical factor. Starting oseltamivir within the first 2 days of symptoms offers the most benefit, especially for reducing symptom duration and viral shedding. If treatment is delayed beyond that window, the benefits are minimal and may not justify its use. In summary, oseltamivir does have some benefits. It can slightly shorten illness duration, reduce viral shedding, and provide strong protection against infection when used as a preventive measure in exposed individuals. However, it does not significantly prevent hospitalization or serious complications in healthy outpatient populations. The decision to use it should be based on individual circumstances, timing, and risk factors, always in consultation with a healthcare professional. Remember, while it can be helpful, it is not a miracle cure, and managing flu also involves supportive care and preventive measures like vaccination.